Hey, good morning, everybody. This is Brittany Jennings coming to you live from Seniors Blue Book. This morning, I'm joined by my wonderful friend, Rachel, with Fusion Healthcare. Good morning.
Good morning. Thank you for having me on.
I'm so happy to have you. You are hilarious, number one, but always a pleasure to be around and learn from in the home health world. So, Rachel, if somebody is watching and they don't know you yet, which would surprise me because you are Rachel Flanagan, you are everywhere. Tell the viewers a little bit about yourself and your background.
Okay, so a little bit about myself. I'm originally from Lakeland, Florida, so I'm a native Floridian. Whoop, whoop. Not a whole lot of us, but I moved to the Bradenton area after my husband retired from the Air Force 7 years ago. Previous to Fusion, for 17 years, I was a business owner, entrepreneur in publishing and marketing and advertising, and owned publication franchises, and got out of that about 4 years ago. Took a few years off, and then Fusion fell into my lap, and it was a perfect fit for me. Business to business basically is what I had done for 17 years. And I love helping people. So I really enjoy what I do. Being able to help people out there in the field and helping patients, helping my clinics, my doctors. I have a saying for myself: I'm just not somebody that's going to change your bedpan, help you. So I'm really appreciative for those clinicians out there who are those people. But I need a t-shirt that says that. I love helping you. I'm just not going to change your bedpan.
I mean, but I know you, and I know you would do it if you had to. Yeah. Just like me, I'm better on the other side of that. Somebody would be better to help, but we would jump in, right?
Yeah, absolutely. If it needed to be done, I'd take care of it. So Fusion, I've been with Fusion. February will be my 2-year anniversary. So I'm very excited to be with Fusion.
I didn't know, I really didn't realize you had been in basically what I do, publications and things like that. So after this, you'll have to share some skill set with me. So tell us about, Fusion Healthcare. So when people hear Fusion Healthcare, what should they think of? Tell us a little bit about the company.
So Fusion Healthcare has been around for over 20 years. It's a single person owned, local business. So for those who are interested in supporting local business, Fusion's definitely a local business. We're not some big corporation, with a president and CEO and, things of that sort. But they started here in the Manatee, Sarasota area all those years ago, and now they've blown up to 11 counties up and down the Gulf Coast and in part of Central Florida. We're 5-star rated in most of those counties. Here in Manatee County, we're a Medicare 5-star rated agency, which puts us, I think, in the top 5% in the country, which is a big deal. Our outcomes are just amazing. We have some of the lowest hospital readmission percentages across the board here in Manatee County, which is a really big deal for our patients, staying out of the hospital. It's a big deal for the doctors that their patients are staying out of the hospital. And we have some very specialized programs to Fusion that I really like. Our Unforgettable program, which is a holistic approach at assisting and helping to slow the cognitive decline processes, which is really a big deal for our communities, in Florida because of our high rate of, senior citizen population. Our Just Breathe program, which we launched just before COVID really struck, which is a respiratory strengthening program. It's like a workout for your respiratory system. Looks like this. But it's a skilled nurse or a physical therapist. They utilize this special tool to really help strengthen those respiratory systems, working them out, getting them strong, which is a big deal for our senior population to keep that strong. So even if they did contract COVID, if they have that strengthening, they could have definitely better outcomes with that. It's good for patients with COPD, stroke, congestive heart failure, Parkinson's, muscular dystrophy, any track weaning, hypertension patients, and of course, those who are recovering from COVID. And then they get to keep that tool so they can use it on a daily basis to help keep them strong. So that's an exciting program, especially with what's going on for right now.
Absolutely. And I mean, what timing to have, because obviously with COVID. And so I want to touch back on the low admission, readmission to the hospital. it's so important and so vital right now, of course, and still remaining that way, unfortunately, but we're still in the thick of everything going on. So I want to kind of jump back into, do you kind of know what the average home health readmission rate is compared to you guys?
In fact, actually, I have let's see here.
Because as Rachel's
The
looking that
count,
up, oh,
yeah,
go ahead, Rachel.
I actually have it here. The county average is 11.4%, and Fusion is at 6.69. The state average is 11.56, and that's the 30-day readmission rate. So, I mean, Fusion is half lower than the county average.
And to kind of break it down for people, so when somebody leaves the hospital and home health is ordered, talk about kind of how Fusion does the process of admission for that person. I'm sure it's instant. It's an instant admission that somebody comes out and starts that case. But talk a little bit about that process and probably why you guys have such a low admission rate, readmission rate. Sorry.
So, I mean, we start care within 24 to 48 hours, which is the standard, which is what most home health agencies do. We have a special transition program that encompasses a lot of extras that we do as a courtesy, especially for our high risk patients. We like to get involved before that discharge with the family, especially if somebody's going home alone. So this is separate from, people going home to a facility. And we just have a lot of specialized things that we do, making sure there's food in the home before they come home, assessing different types of things with the patient to make sure it's safe for them to come home by themselves. We had one patient that before we had taken this patient on had been back in the hospital like almost every month for 9 months. And whenever she was finally referred to us for home health, we utilized our special Bridge the Gap program for transition and had kept her out of the hospital. She didn't have those readmissions anymore. So, we do have specialized programs. The Bridge the Gap program is one of those programs that helps to facilitate keeping those high-risk patients out of the hospital. We just have some of the top clinicians and physical therapists, I feel, here in the state of Florida that really help to lower those readmissions as well, but really getting on those cases immediately as well.
Absolutely. And let's kind of end with just how things have been through we're looking at the last 7 to 8 months here. How has Fusion kind of gotten through this time of COVID? What has changed with you guys and maybe protocols?
Well, I mean, home health is home health. In the beginning, in the first round of COVID, people were afraid to go to the doctor. They were afraid to have home health come to their homes, especially our high risk patients, which is completely understandable. But now telehealth is in full swing with all doctors. Home health can help to facilitate those telehealth visits with the doctor so that patients aren't negating care that they need. And, there's so much that has evolved from COVID to making receiving healthcare a lot easier to get. Even CMS has changed the guidelines of who qualify as homebound. Before you had to have a true homebound status. Now, if you are considered high risk at contracting COVID, so if you have a disease process or you're over a certain age, they've expanded those boundaries of qualifying as homebound. For instance, my mom isn't typically homebound ever, but because of her age, she's considered high risk at contracting COVID, and she really needed physical therapy for a knee injury. And she was able to receive home health for that knee injury rather than going outpatient for physical therapy for her knee. And that was a tremendous help to her. And so things have evolved that way as well with home health, expanding those boundaries of who now qualify to receive it. And like I said, home health can help facilitate those face-to-face telehealth visits with physicians. I know that a lot of our elderly out there who are at home are intimidated or just don't even have the proper equipment to have those face-to-face, to have the doctor's eyes put on that patient when they really need it. And of course, just like any other home health agency, our clinicians and therapists all have the proper PPE, are getting the regular testing and things of that sort to protect the patients.
Definitely. Well, you guys are incredible. I want to thank you so much for everything that you guys are doing out there, because we know too, when you go into a home of a new patient or client, that you think you're going in for one thing, but then, you know, you kind of get those wings, you have those angel's wings, because then you realize there's a lot of different things that you need to connect them with resources. So
Mhm.
home healthcare is a field where you truly have to have a talent and a heart for what you're doing. So thank you to you and all your clinical staff.
Thank you.
If somebody is interested in Fusion healthcare and they want to know how, you know, if somebody says, how do I get on service, or they might have some kind of a, you know, an illness or something going on, tell us a little bit about how can somebody get Fusion healthcare right now.
So there's several ways they can do that. They can either just contact us direct, and we can help facilitate that through their physician to get orders for home health order to see them. Of course, that may require a visit with their doctor, depending on how long it's been since they've seen their doctor. Or they can just go to their doctor and request it from their doctor direct and let the doctor know that they want to use Fusion Home Health.
Perfect.
It's
And
pretty
it's a
simple.
Medicare or insurance covered benefit, correct? That's also important for people to know.
Yes, correct, correct. Yes, and Fusion, of course, we're a Medicare agency, but we also can help with some of those commercial insurances as well.
Perfect. All
Mhm.
right. Well, Rachel, again, thank you to you and your team for everything you're doing out there. I will make sure to add into this post, of course, all the information of how to contact you, as well as, you know, just your guys' main phone number if somebody would like to go ahead and get on service. And thanks for everybody for tuning in, and have a wonderful day. Bye, Rachel.
Thanks for having me. Have a great day, guys. Bye.